Hello, my name is Julia Henry and I am a public health major. This disease investigation will focus on epilepsy. We will end our investigation with a quick look at Healthy People 2020's goals and objectives for this disorder. Epilepsy is a neurological disorder characterized by recurrent seizures. A seizure is a misfiring of electrical impulses in the brain that alter behavior, sensation, or consciousness and can result in involuntary movements and jerking of the body. Epilepsy is considered a spectrum disorder as there are many types of seizures and the disorder varies in severity. There are many categories of seizures depending on the cause and the area of the brain that is affected. A single seizure is known as an event and as many as 10% will experience one in their lifetime. This does not mean they have epilepsy. A person is diagnosed if they have had 2 or more seizures not caused by a known reversible medical condition. A person who has a seizure needs to see a neurologist, a doctor who specializes in brain disorders. The doctor will want to know the events leading up to the seizure, what happened during the seizure, and the effects afterward. She will order an EEG or electroencephalogram, which measures electrical activity in the brain. Some common imaging studies include an MRI or a CT to look at structures in the brain. Blood tests may also be performed to evaluate any other medical conditions. It is not uncommon for these tests and procedures to come back completely normal in those with epilepsy. The most common cause of epilepsy is idiopathic. 6 out of 10 cases have an unknown cause. Some known causes include head injury, brain infections such as meningitis, genetic problems associated with brain malformation, and tumors, to name a few. These can also be considered risk factors for developing epilepsy. While epilepsy cannot be prevented, one can reduce risk by practicing safety to avoid severe head injury and getting good prenatal care. A family history also increases the risk. The goal of treatment is to stop or control seizure activity. In 70% of people diagnosed with epilepsy, an anti-epileptic drug can control seizures. Surgery is an option for those with severe epilepsy. A ketogenic diet is tried mostly in children with poorly controlled seizures. It is high in fat and low in carbohydrates. A new treatment being explored is the use of marijuana to control seizures. More research on this method still needs to be done. Epilepsy is the 4th most common neurological disorder after migraines, strokes, and Alzheimer's. Millions are living with epilepsy, and an estimated 80,000 live in North Carolina. Anxiety and depression are comorbidities often found in epileptics. There is an increased risk of premature mortality, but it is very difficult to measure. Common causes of death are accidents, drownings, status epilepticus, which is continuous seizing, suicide, and SUDEP, or sudden unexpected death in epilepsy. This occurs in an individual with epilepsy in whom, upon post-mortem examination, does not reveal a structural or toxicological cause of death. Government and private organizations are working together on control and prevention, research, and to raise awareness. The IOM recommends better surveillance, access to treatment, and public and professional awareness and education. Education is a large part of prevention and control. Educating patients with epilepsy, their families, the public, healthcare workers, and physicians will lead to better management and care and preventing injury and death. Healthy People 2020 lists its objective as increasing the proportion of people with epilepsy and uncontrolled seizures who receive appropriate medical care. Currently, that proportion is 57.7%. A goal has been set to increase that rate to 63.5%. In North Carolina, medication assistance is one of the top needs of persons with epilepsy. This concludes our investigation. I hope you found it informative, and thank you for watching.